Like you, when I heard Neil Houston first present the program, I was wowed by the safety climate survey. Now, can you tell me the rationale for him convincing you that that wasn't a good place to go in the first instance?
The answer was he wanted simple wins. It was that in a nutshell. He felt that doing something that you could measure easily and then reflect on through improvement, simple steps of change, is what gives buy-in from a wider group of people. And the safety climate survey was just a bit scary, he felt, in the first up. He felt that you needed to encourage people to engage in having a safer practice before then challenging them to reflect on the safety of the entire practice.
Right. Okay. Thank
Just
you.
On that regard, it's really interesting about language and important things and expertise, because I forgot to mention PDSAs, which Anne mentioned. In general practice, we do this for MOPS, and in PDSA for us is the whole process. We start at one point and we finish after we've done a year worth of work. We have an innovation. That's not what a PDSA is. It is part of the PDSA work, but PDSA will be about making one change for one patient as one trial and following it up, and that would be simple and quick. So as much as Anne also said, we've got to challenge ourselves and do the scary things, in this work you also have to do small things as well. So, we may not know what we don't know, so it's important to have experts around to help you out with that. And Neil was a guiding light in this regard.
Thank you. Okay.
Hi, I'm a general practitioner from Dunedin. One of my locums consistently writes when she changes a medication in the prescription. This was decreased and she dates it. And that is so much quicker than me picking it up from the written notes on the computer.
Yeah, you have to use, I guess, if you're going to use trigger tools, use whatever is practical. Everyone's going to have slightly different things they do in the practice. Yeah.
Can I just also make a reflection on that? I've just recently joined a practice which has gone through a massive amount of change, and interestingly, one of the things I found within the system is that there's lots of those things in there. So they're actually in this blue ongoing medication. So every time you reprint it, it says, I've decreased this medication. So it's also important to continue to be aware of and adapt that medication, to reconcile it regularly. I think that's one of the good things about a care bundle in regard to medication reconciliation. It actually gets you into the habit of reconciling it on a regular basis.
Hi, Richard Hume from Auckland General Practice. Look, I really enjoyed the presentations today, and I guess one of the things from a change perspective is funding and getting buy-in from busy practices. In terms of sustainability, is there any possibility that the college might look at these kinds of tools being part of MOPS so that it doesn't become dependent on funding, but actually becomes part of what we do as a quality assurance activity?
I can answer part of that. One of the outcomes, which I should have mentioned in terms is that all of the safety and practice work is actually now MOPS accredited, and both in terms of being a part of the bundle of care, trigger tool work, but also as peer group work around the safety and practice work, which is outside of that. Some of the time you do develop peer group work, so that's also moppable.
So the college is part of the overall governance group of the program now, and certainly looking at being more involved, especially around the safety climate survey and the other initiatives going forward. So yes is the answer. Thank you. That's a nice place to finish.
Can I just work one other thing? If you have a look at the IPA framework, you'll actually find that the safety and practice really has quite an interesting overlap with it. So there's lots of ways to encourage people to buy into it.
Thanks, Bevan. So what an interesting session, and I hope that you do now have some further ideas for tools to help you enhance your practice come Monday. And I know that the team will be here for the rest of the day, and indeed the conference too, if you have any further questions. So could I ask you again to thank each of our three speakers.